Okay, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. First of all, I'm thankful for the scientific and organizing committee for inviting me. معكم Dr. Athman Radwi. We'll be speaking, inshallah, about the immunogenicity of the Pfizer and AstraZeneca vaccines in patients with hemoglobinopathies. This work was in collaboration between clinicians and scientists at King Fahd Medical Research Center. A little bit of background before we indulge into the work that we did. Hemoglobinopathies are a group of inherited disorders, including sickle cell disease and transfusion-dependent thalassemia. In Saudi Arabia, according to the pre-marital screening and genetic counseling program, which is, I believe, the biggest program assessing the prevalence of hemoglobinopathy in adults from 2011 2015, updated every 5 years. So it showed that actually the prevalence in Saudi Arabia is 3.8 per 1,000 individuals, and for beta thalassemia, which constitutes a major part of transfusion-dependent thalassemia, the prevalence is 0.7 per 1,000 individuals, a pretty large number to consider when treating our population. Studies, actually 3 major studies that looked after what happens to these patients whenever they acquire COVID-19 infection and needs hospitalization. They looked at the mortality rate, and it was actually elevated up to 2.5% in patients with sickle cell disease and around 15% in patients with transfusion-dependent thalassemia. Pretty big number to consider as well. That actually led, or even from before, the American CDC and the Thalassemia International Federation and also the NHS from England recommended to the hospitals and to care providers that patients with hemoglobinopathy should be prioritized to receive the COVID-19 vaccine. This is basically based on factors that, including combined, both patients might had a history of splenectomy, and we understand the role of splenectomy in the immune responses, either in the innate or later niche immunity. Also, both can use hydroxyurea, especially patients with sickle cell disease, and some controversial data regarding the use in thalassemia as well. We understand these patients receive frequent blood transfusion, which will lead to iron overload and iron deposition in the system of their bodies, and the need for use of iron chelation therapy, and what can really lead to side effects, including agranulocytosis, which affects immunity. So when I was in the clinic with my students, which I actually shared in writing the manuscript of this paper, we had a patient who asked us, do I need, or what is going to happen to my body when I will receive COVID-19 vaccine as a hemoglobinopathy patient? So I went to the literature and tried to find any evidence around it, and well, none exists actually. What happens to these patients in terms of immunogenicity? Are they going to mount a sufficient immune response to fight against COVID-19? So what we went and did, so more than 300 adult patients are actively, hemoglobinopathy patients are being actively treated at King Abdulaziz University Hospital. We approached them. We asked about vaccination status, how many doses they received, what were the dates of the vaccination, and what type of the vaccine, whether Pfizer or AstraZeneca. We asked them about the hydroxyurea use and how compliant they were to it, splenectomy status, if they had any history of splenectomy in the past, and even awareness about if they had a previous COVID-19 PCR nasopharyngeal test as well. If agreed, we went and collected blood samples 14 days post-vaccination. The 14 days was actually extrapolated from other similar trials in other conditions, hematological conditions. And if the patients were approached after receiving the second dose, yes, unfortunately, it goes to everyone. So if we collected after the second dose, then no need for another blood sample. And if we collected after the first dose, we invited those participants to provide a second blood sample 14 days post second dose of the vaccine. What we did for the blood samples, we assessed the serum ferritin level. We did the binding IgG antibodies for the COVID-19, including anti-N, anti-S1, anti-RBD. And the primary point of our study was actually assessing the neutralizing antibody titers, which are the most important one when evaluating COVID-19 antibodies. I said more than 300 patients were approached. Well, we only had 66 patients, which is the story whenever you do a clinical research recruiting patients. Most of them, as posted in the picture here, shows that they were actually transfusion-dependent thalassemia, and 1/5 were actually sickle cell disease. This is table 1 of our study. After we went and assessed the demographic values, we checked how many doses they were receiving. We collectively said either you're transfusion dependent or you have sickle cell disorder. Splenectomy status, hydroxyurea use, and hyperferritinemia were defined as having more than 1,000 microgram per milliliter. And guess what? Yes, 82% were actually having this value. And history of COVID-19 infection, which is basically figuring out if they have positive anti-nucleocapsid antibody in their serum. And when we correlated these values against mounting a neutralizing antibody response, we found significant value when actually you have when you receive 2 doses, that you will have a significant neutralizing antibody response, and also if you were known to have previous infection. Sorry for this busy slide, but I will try to fracture it as possible. So this group A here shows that the red column is showing that if you were previously infected, either you receive 1 dose or 2 doses of the vaccine, you will inshallah mount a good response for hemoglobinopathy patients. If you were non-infected in the past and you received only a single dose, we can see that suboptimal response will be, you will have high chance to have a suboptimal response if you are hemoglobinopathy patients. Figure B here actually shows what if you took a homologous vaccine like Pfizer, and the first dose was Pfizer and second dose was Pfizer, AstraZeneca, and what happens if you took a heterologous type of the vaccines. And in both pictures, we can see actually 2 doses would help, but priming the vaccine with Pfizer, which is an mRNA vaccine, would have better responses. Figure C and D here is actually showing both anti-S1 and anti-RBD, which are the commonly used antibodies for assessing COVID-19, and all participants actually had a very good response. But reminding you, the neutralizing antibodies are the one that we're looking for. That tells you that the patient would have high chance for immune against COVID-19. Among the 66 participants, only 17 returned again to give us a second sample to get to us to be assessed. And yes, you can see all the responses are actually better when they receive a second dose of the vaccine. Only 1 patient, unfortunately, did not mount a good response. When we evaluated the gender, the age, type of hemoglobinopathy, whether thalassemia or sickle cell, splenectomy or not, using hydroxyurea, the level of high ferritin, they all did not affect the neutralizing antibody significantly. We went and did a subgroup analysis thinking about thalassemia and sickle cell disease are different biological characteristics, and we did a subgroup analysis, and we did not reveal any different findings. We also thought about, remember we said only 14 days at least, some patients presented to us 90 days after the vaccination. Well, that even did not find any statistically significant relation to the measured antibody response. In summary, 85% of hemoglobinopathy patients can mount a neutralizing antibody response, alhamdulillah. The response is markedly increased by previous infection and the second dose, getting booster doses of the vaccine. Asymptomatic COVID-19 infection can occur in hemoglobinopathy patients, and they don't know about it. 47% of our cases, of our participants actually had COVID-19 without knowing. The regular medical available interventions that we provide to our patients, including hydroxyurea, splenectomy, iron chelation, they all did not affect the immunological response. Yes, we had 66 participants, so it's a small sample size. We did not have a control group, patients who had, or participants who had splenectomy for other reasons, hydroxyurea for other disorders or hyperferritinemia. And unfortunately, we did not measure anti-N at baseline, as is not in our protocol at the beginning. So in conclusion, we are not only the local, but we are the first international study to report comprehensive antibody response to COVID-19 vaccination in our precious population of hemoglobinopathy, which is actually kind of we have a lot of patients in Saudi Arabia with a high prevalence. We all agree that vaccination helps, and 2 doses are better than 1. We don't know yet what happens after the 3rd booster. Remember, 85% did have a response. Well, 15% did not mount a neutralizing antibody response, which even despite having 2 doses of the vaccine. So we still recommend that patients rely on protective measures as well. We were happy, actually, alhamdulillah, fadl min Allah subhanahu wa ta'ala. We published this paper back in the vaccines, which is a Q1 journal, 6 weeks ago, alhamdulillah, with all my colleagues. And with that, I provide a special thanks to the King Fahd Medical Research Center, including Hematology Research Unit and the Vaccines Immunotherapy Unit, and also my colleagues in King Abdulaziz University Hospital. And